dancers, how are you all doing? I'm Dr. Divya Raghavan, and today I'm going to talk about the ankle and the foot. So, ankle and foot is a part of the body which takes so much strain, especially in dancers, because we mostly do it barefoot, right? But it's one of the most ignored parts of the body. Like, you don't go to the gym and see equipment for ankle strengthening and foot strengthening, right? You see people stretching their hamstrings and stretching their quad, but not really stretching their foot or moving their ankle toe muscles. So let's talk about the basic anatomy. Now, the foot joint has so many bones. It's a very complicated, lot of things happening. There is mobility, stability, dexterity, like again, it needs to be handled with care, and most of us don't, right? And so I see all kinds of issues in dancers with ankle and foot, and especially in ballet dancers, right? Like going on point puts so much stresses on the toe joints. Staying in that like 180 degrees of plantar flexion, right, when they are on their point, causes like problems in their heel bone. I see Achilles tendon problems in a lot of ankle sprains. So the three most common injuries that I see for the ankle and foot is plantar fasciitis. Plantar fasciitis is inflammation of the plantar fascia, which is a fascia on the under surface of the foot. So the foot has an arch, right? And the arch is supported by a fascia known as a plantar fascia. And if you do too much of like jumping, leaping movements and do not have that supportive footwear, right, because probably you're doing it barefoot, then the plantar fascia can get overstretched. Or people who have a flat foot, right, they don't have too much arches, now start putting too much stress on that arch, which is already kind of like stretched out and weak, then start having issues with plantar fascia. Most of the common symptoms of plantar fascia is like pain in the morning. Like the first few steps you take in the morning is really painful, and then as you go through the day, the pain decreases. The other common injury that I see in dancers is ankle sprain. And ankle sprain, you know, everybody has it, right? Most of the time it just gets better on its own in a few days by following the rest, ice, compression, elevation, the RICE protocol. But ankle sprain, if ignored, or if you've had a grade 2 or a grade 3 ankle sprain and you've not done much about it, and if you've had it in the past, it can again cause issues with chronic ankle instability, where you feel that the ankle kind of like, you know, twists again and again anytime you do a movement. But also I see acute ankle sprains where you've just done a movement and had a sprain. Usually if you go to a doctor, they would do an x-ray to kind of rule out any fractures, but there is these Ottawa ankle rules, which I do for my patient who has had an acute ankle sprain. And if we do those Ottawa ankle rules, we'll know if that person actually needs an x-ray or not. So, you know, a lot of unnecessary imaging can be stopped, or, you know, should not be done if not needed. And again, if you see a doctor of physical therapy as like me, then I'll do an ankle assessment, and I will tell you if you need an MRI, an X-ray, a CT scan, and most of the things do not require any of this imaging. I can do clinical tests and come to a diagnosis of what structure is injured and what kind of treatment will it need. The other common ankle problem that I see is Achilles tendonitis. The Achilles tendon is the tendon in the back of your heel. It's the tendon of the calf muscle. It's the strongest tendon in the body. And Achilles tendonitis can again be chronic. And tendonitis is usually caused by an acute strain where, you know, pain starts happening when you're going up on your toes, when you're doing running, when you're doing jumping. If again it's ignored and it stays for a long period of time, it can lead to tendinopathy. Tendinopathy is where there's degeneration of the tendon. So the tendon loses its structural integrity. It looks the same from the outside, but it's not as strong. It's not able to kind of take those stresses that an Achilles tendon should be taking, because it kind of Achilles tendon kind of lifts the whole body up on the toes. So the calf and the Achilles are supposed to be very strong, right, and should stay very strong. So let's talk about a few exercises and stretches that you can do to make sure your foot and ankle are happy. And if they're unhappy, hopefully they will feel better after you do these stretches. Okay, so what I'm going to talk to you about today is how to roll your calf muscle using a stick. Right? So this is called the stick. All right. So it's a stick roller. It's extremely cheap. I got it from Amazon, and it's very handy. I have a lot of my patients kind of travel with it because it's easy tool to use and it's light. For the calf muscle, you kind of keep your knee in a bent position and then hold the stick with both hands and then roll your calf up and down. Right? And you can put as much pressure as you want. Do it on the inside part of the calf, do it on the back part of the calf, and on the side part of the calf. You can also do it on your tendon, so coming lower. The calf is made up of two muscles. This big bulky muscle on the top is your gastrocnemius muscle, and the lower muscle is the soleus muscle, and the lowermost part is the Achilles tendon, right? And you roll this. You can do this for again 30 seconds to a minute. It's a good TV watching exercise to do, and you can roll out your calf and take out all those knots and kinks, and so that the blood circulation improves, and then you improve your ankle mobility. So what I'm doing right now is rolling the bottom of my foot using a lacrosse ball. This exercise can be done in sitting like I'm doing right now, or can be done in a standing position, and you roll all the way from your heel to the top of your toe, and you can do it towards all the toes, so towards the ball of your feet. And if you find any area that's really tight, you can actually spend a little bit more time on it. A great exercise to do for people with plantar fasciitis or cramping in the calf, and or people who have foot fatigue. Not only for dancers, but also people who stand for a long time for their jobs. Dance teachers, especially if they're doing class after class, can feel this foot fatigue or plantar fasciitis, and so this is a good rolling technique to do. So this exercise is called towel scrunches, and this is to help improve the strength of the muscles in the bottom of your feet or your toe flexor muscle. So you take a towel and then you try to create wrinkles in that towel by grabbing the towel. And then if you can, you try to pick up the towel. See, I'm not raising my heel up, I'm just picking it up from my toes and putting it down. Again, go to a different part of the towel, scrunch the towel, and see if you can pick the towel up. Not an easy exercise, okay? And sometimes it's frustrating that you're trying and you're not able to do it. Especially people with flat feet, they have weakened toe flexors, so find it harder to do this exercise. On the other hand, people with high arches can use their toes almost like the hand, right? They have a lot of coordination and strength in their toe muscles. So great exercise to do. Again, a good TV watching under your desk kind of exercise that you can continue to do while you're working, and will help improve the ability to kind of jump up and do different movements on your foot. So this is a good exercise to do for people with Achilles tendon pain. So you take a step, right, and then you go up on your toes on both sides, and then shift your body weight to one leg, the leg that's hurting, and then come down. Again, go up on both, shift your body weight onto one leg, the leg that's hurting, and slowly go down. Again, go up, shift weight, go down, go up, shift weight, and go down. You should take twice the amount of time to go down as you're going up. So if I'm going 2 seconds to go up, I take 4 seconds to go down. 2 seconds to go up, and 4 seconds to go down. This exercise has to be done for 15 repetitions, 3 sets, and you might feel some discomfort in your Achilles tendon when you do this exercise, but that means the Achilles tendon is getting stronger. You can start by just doing 10 reps once a day, and then move on to doing those 3 sets of 15 repetition 2 or 3 times a day. So I hope you all enjoyed hearing a little bit about the ankle and foot joint and how to care for those joints of your ankle and feet. Again, these joints are very complicated joints, and sometimes it's kind of difficult to kind of self-treat an injury. So if you find yourself being stuck and you have a current injury or you have a past injury which is still kind of not better, then feel free to contact me. You'll receive my contact information at the end of the video, and if you have any questions, you can call me or send me an email, and then we can set up a phone consultation. It's free of charge, and we can talk about what's going on with your ankle and foot and see if this is something that will get better with physical therapy or if it's something else that you need. I look forward to hearing from you. Stay safe and stay healthy. Take care. Bye.